Again, welcome. And how about the first 5 days after the surgery? What's your opinion? How's it feeling? How's it going?
The first day it was hard, it was, but I sleep a lot, and then every day it's better.
I think now it's better.
Yes.
It's not like an operation after the surgery. Maybe your feeling is maybe before the surgery. Huh?
Almost.
Uh-huh.
Yes.
If there is a pain anywhere?
A little. Some contraction.
Some movements in
some
the
movements.
bowels.
Yes.
As you know, we perform the metabolic surgery, so not only the gastric sleeve. So we change the line of the bowels, the road of the bowels.
Yes.
So we move the bowels, so you feel these different feelings in the stomach.
Yes.
It's the normal. But how's your hungry feeling?
No hungry.
No hungry.
No.
You don't want to eat anything.
I eat, but
You don't. No.
then it's
But I think you take only few spoon of soup.
yogurt or soup, and it's enough.
It's enough for
Yes.
you. You don't feel hungry?
No.
No. Do you want to eat anything now?
No.
No. Nothing. When you compare before the surgery, how can you explain before the surgery and after the surgery?
Before the surgery, I always want to eat.
After the surgery,
No.
you don't want to eat.
No.
Before the surgery, what's your specialist food?
Carbohydrates.
Yeah, koolhydraten.
Carbohydrates.
Carbohydrates.
Yeah.
Now, how's your feeling? Do you want to eat carbohydrates? No. No.
It's special. It's strange.
Yeah, as you see, it's not the sleeve effect. It's not the only gastric sleeve effect. We use your bowels for this effect. It's a different surgery for you. That's why you don't want to eat any carbohydrates. It's a different. And it's the different also from the standard gastric sleeve.
Okay.
And also different from the standard gastric bypass. You know, it's like a sleeve plus. It's the compare it's the combination with gastric sleeve and gastric bypass. It's the combination, the surgery we perform you. That's why you don't feel dumping syndrome. It's really important. As you ask me about the dumping syndrome, you know, after the classical gastric bypass, the patients feel dumping syndrome. But we protect the normal line in the surgery, normal line. So that's why you don't feel dumping syndrome, and also your normal line is continue, the foods continue that road. So in the future you do not need any vitamin supplements as gastric sleeve. It's the really the upper type of the surgery we perform you. That's good to hear you these good wishes. And also, how about our team, our dietitian or our nurses? What's your opinion?
They're very sweet.
Is the safety surgery? Is the safety hospital? What's your opinion?
Yes, it's very clean, very modern. Yes, they control you every minute.
2 hours.
Yeah, 2 hours.
Two
Yeah.
hours.
Yeah.
Yes, and they're very sweet, warm. Yes.
I think you like our team, our
Yes,
surgeon, my
all
colleagues.
friends.
Yeah. And we teach you, we tell you the diet programs.
Yes.
You know. I think you learned the first month diet program.
Yes.
For the first 3 weeks, it's really important to do not drink any solid foods. It's really forbidden. You must be careful because you know there are some sugars there, and we have to protect from the pressure, inside pressure. When you take a solid food, for example, solid, you know what the solid?
Yes.
Yeah, solid foods, it will damage the sugars. So for the first 3 weeks, it's really important to take only liquids. As you say, you can use the protein and the vitamin supplements. I think you show to my dietitian and they say, okay, you can use that
Yes.
protein vitamins. For the first 3 weeks, you use these supplements. After the 3rd week, my dietitian told you the vegetables and the eggs, as you know. For 1 week, you use these cooked foods. After the 1 month, as they told you, You can eat everything but without carbohydrates. Now you don't want to eat carbohydrates, but later if you don't, but if you eat carbohydrates, you will feel pain
Okay.
and you will be diarrhea.
Okay.
Your mind do not want to eat, but before habit,
Yes.
your habit is to take this carbohydrates. If you take this carbohydrate, you will feel pain and you will feel diarrhea,
Okay.
and you will feel you have a really bad pain.
Mm-hmm.
But if you use your new system,
Mm-hmm.
you don't feel anything, and you will be very healthy, and you will stop your obesity, and you will reach your normal weights, and especially without any disease and without any medicine.
Mm-hmm.
After the 1 month, you must be careful. It's really important. You mustn't take any carbohydrates, also bread, also chocolate, also and other things. Now you don't want.
Mm-hmm.
You have to change your habits.
Yes.
You have to change your eating
Lifestyle.
behavior. You have to change your lifestyle. It's really important. This surgery couldn't protect you all of your life. This is only the weight loss surgery. You must be aware of this topic. This is a weight loss surgery. So you have to change your eating behavior. You have to change your habits. You have to change your lifestyle. Otherwise, you will regain weight in the future, 5, 10 or 15 years later. Maybe we perform you a new procedure. But you have to control yourself. It's really important to protect this new body. And after first 1 month, we give you some medicines. As you see, what we give you, the pain, stomach protectors. We gave you the pill and the liquid. The liquid will finish after the 2 bucks. The pain, the stomach protector, the pill,
Yeah.
you stop 1 month later. You don't use in the future. And we give you antibiotics. The antibiotics will stop after the bucks finish. You don't need to take another one. And we will give you a paracetamol for the painkiller. Did you use?
Yes.
How many times
4 times a day.
per day?
1 tablet.
1 tablet.
Yes.
Okay. Now you are using?
Yeah. Sorry?
Today,
Yes. Yes.
did you use?
Yes.
You feel pain
Yes.
and use it, the
Yeah.
painkiller.
Yes.
Yeah. As I told you, if you don't feel pain,
Don't use it.
you don't use.
Yeah.
It's really important. If there is a problem, you can contact us, also your company, from your company. We will answer all of your questions every time. And you have to learn that after the 1 month, the diet program we gave you continue till you reach your normal weight. When you reach your normal weight, a little change we will give you. Maybe we increase the size of the foods, but in the future, when you reach your normal weight. There isn't any protection for you in the future. The shears will fall down by itself. Some pets there, they will fall down by themselves. If not, you will remove them 10 days later. You can take a bath, you can swim, you can do whatever you want. You can carry whatever you want. Okay?
Yes.
Your shape is really good now. Your body, I think there isn't any disease now.
No.
Yeah, so you can fly safely.
Yes.
Okay. If there is a problem, do not hesitate to contact your company also with us. Okay.
Yes.
Nice to meet you.
Nice
Have a
to
good
meet you.
flight if you haven't any question. No.
Everything is clear.
Yeah,
Yes.
okay. Nice to meet you.
Thank you.
Doctor, nice to meet you. Have a good flight.
Yes, thank you. Thank you.
Can you introduce yourself?
Yes, I am Monique Borst. I'm 50 years old, and all my life I am on a diet, and it doesn't work.
Which operation did you do with FlyHealth?
They give me a super sleeve. It's a combination from gastric bypass and a sleeve operation. It's a combination that was the best for me.
How was the process before you came to Turkey?
It was good because you can always ask questions with the email or the app. So 24 hours a day you can app or email. It was good.
Did you have worries before you came? And could we help to solve them?
Yes, I was nervous, but they solved them. They always answer and they were very clear about everything.
Mm-hmm. How was everything? Hosting, hotel?
Yes, very good. It's luxe. The hospital was clean and modern. It was good, yes.
Mm-hmm. How was the doctor?
Very nice. It's a professional and hard-working doctor.
Did he explain everything?
Yes, he was good in English and he explained very good. He take his time.
Okay. How was your time in Turkey?
I didn't see much from Turkey because I had a super sleeve and it's a big operation. So I couldn't manage to see Turkey, but I come back.
Would you recommend FlyHealth to family or friends?
Yes, I do. They are very clear and it's a very good procedure. Yes, they guide you the whole way through. It's very good. Yes.
Okay.
Thank you.
Thank you.